Today's talk is on organic manifestations of psychiatric conditions or disorders or diseases. In current medical knowledge, we have chosen to study psychiatry and its relation with day-to-day practice, day-to-day conditions. Let us see this now. Now, this is some organic manifestations of psychiatric disorders. That is, a patient is suffering from psychiatric disorder, but he doesn't come to you for psychiatric treatment. He comes to you for a physical condition. And these conditions could be digestive complaints, gastrointestinal complaints, cardiovascular complaints, endocrinal complaints, musculoskeletal disorders or complaints, then skin complaints, and gynecological. We have chosen these 6 commonest ones. There are a number of them, but then we will like to choose the most common in our day-to-day practice. So this is very essential for a general homeopathic practitioner to prescribe on the basis of mind, we say. Now, if you are to prescribe on the basis of mind, the study of mind is psychiatry. So, psychiatric diseases, psychiatric madness does not mean frank mad person throwing stones here and there. That is frank madness. That is mania. But that is not everything. There are many psychiatric conditions. So, we are to examine those conditions under this particular topic. Digestive complaints we will take first. Now, these digestive complaints will be taken under these headings, which are particularly 3 in number. Irritable bowel syndrome. People come with IBS, irritable bowel syndrome, then peptic ulcer, then dyspepsia. These are the 3 common conditions where you give them superficial medicines based on the local symptoms and do not get results, because those results are not long lasting. Reason is that we have to know a little more on this. Let us see the irritable bowel syndrome. 70 to 90% of patients of irritable bowel syndrome show psychogenic features, that is depression, anxiety, somatization. Somatization is hypochondriasis, where the patient is over concerned with functioning of the body. So this disease manifests itself through irritable bowel syndrome. Then in about 85% of irritable bowel syndrome cases, psychogenic features either precede, that is, some psychogenic feature existed before the disease started, or coincide, that is, it happens side by side concurrently. Then more tendency to be preoccupied with illness. Subah or sham, from morning to evening, the patient remembers that he is having that particular complaint, over-occupied with that. Then almost 50% of patients have fear or phobia of cancer. Now, this particular cancer phobia is very important because they do not have cancer. Whether they have cancer or not, उसको आप बंद कर दीजिए, फिर आए. Almost 50% of the patients of irritable bowel syndrome, डॉक्टर साहब मुझे कैंसर तो नहीं हो गया है, that is their phobia, and that phobia of cancer is a symptom we know. So that symptom is to be examined like this. Then under peptic ulcer, psychological stress results from insult, punishment. So due to insult or punishment, the stress results. In the history we can locate that and find or repertorize and select the medicine. This topic today we are not covering the medicines, because if we cover the medicines, the concentration on this will be disturbed. So we are exclusively on CMK. So that is, before occurrence, either first time or recurrence, that is next time, subsequent time, there is history of stressful life situation. Then occupational, educational or financial, that is pecuniary problems, family illness, somebody in the family is sick, having cancer or having some disease which needs nursing or which involves stress finally, separation by death or divorce of life partner. There is a concept of life changing unit, LCU, and this life changing unit is a concept in psychiatry which lists number of conditions, and accordingly they give marks on that. If there is death of life partner, that is at the top, because that is a maximum stress. Then if there is a court case, that is also stress. If there is a new job, that also is a stress. If there is marriage beginning as well as marriage termination, both cause stress. Stress type is different. So these are called life-changing units, and in that at the topmost level is separation by death or divorce of life partner. Then in peptic ulcer we have something more. Psychological factors are often related with matrimonial problems, depression, anxiety and phobia. These are also there in the background, but the patient comes to you with peptic ulcer. Then in chronic abdominal pain, psychodynamic factors are found more. And finally, anger plays key role. It makes colon contract. The contraction of colon is there, and then aggressiveness is thus related to pain and constipation. The more the anger, the more the pain. The more the anger, more the constipation. You can give remedy like Naxomica and get a little relief, but it will not go into the depth of that. Then dyspepsia. Under dyspepsia, we find stress is important precipitating factor. Then there is anxiety, depression, hypochondriasis. They are closely related. Then common cause of chronic recurrent vomiting in young women is emotional disorder. Young women come to you with vomiting and you find that there is an emotional disorder behind. So that is to be covered. Causative factors could be sexual or matrimonial disharmony, health problems of relatives. Patients won't shoot and tell you these things unless you carefully get it out from them. Loss of parental affection. Then also caused by major depressive disorder or convulsive disorder. So that covers our first part, which is digestive. Then we go to next one, which is cardiovascular. Then in cardiovascular, we see the conditions myocardial infarction, coronary artery disease, cholesterol and atherosclerosis and other features. Maybe that the patient is getting treatment for this condition, and after getting the hospital treatment, he comes to you. Here you are to look into the factors which are behind and understand the dynamics. Let us see them. Under myocardial infarction, commonest complications of infarction are anxiety and depression. That is, once you have a heart disease, then you have this anxiety and depression. Then 30 to 50% of patients, depression precedes myocardial infarction. That is, there is depression first, some reason, depression, and followed by myocardial infarction. Depression is associated with increased morbidity. That is more serious condition, increased morbidity and mortality, of course. So associated with MI 5 times more than in non-depression people. That means if the patient doesn't have depression and patient has depression, these two populations, the number of times is 5 rated in favor of depression. Now remember, we have seen that depression is highly related with SORA. So our interpretation homeopathically will be from our angle. Then role of anxiety comes next to it. After depression, it is the anxiety. About 20 to 25% of the patients have major depressive disorder, patients of myocardial infarction. Nearly 1/4 of them have depressive disorder. Then in coronary artery disease, we see 20 to 40% of CAD patients have depression. Now this is nearly 1/3, more than 1/3. This is more than 1/3, they have depression. Then increased anger and hostility is associated with cardiac morbidity and mortality. It was there in digestive system also, in peptic ulcer also, and here also there is increased anger and hostility. Then cholesterol and atherosclerosis. Stress induces in patients with atherosclerosis, MI, and coronary vasoconstriction. There is a background of atherosclerosis, add stress to it. An incidence of anger can trigger acute mood disorder, then it can trigger then subsequently, because of acute mood disorder, the chain will continue. Then cholesterol rises 5 times with these conditions. Read them. Depression, hostility, emotional instability. Then cholesterol, smoking and hypertension. These are commonly explained by everybody as 3 kingpins. 3 risk factors, biggest risk factors, that you should not have cholesterol, you should not smoke, you should not have hypertension. But the biggest risk factor is depression, which is undermined. Depression is greater risk factor than these 3. And depression patients neglect self-care, they do not care about themselves, they will smoke more, they will drink more alcohol, they will pay less attention to regular exercise, medication, and in turn they will destroy themselves. That is why depression is more important, is a bigger risk factor. Then there are other features of cardiovascular disease, like acute stress increases myocardial oxygen demand, and secondary to vasospasm, coronary blood flow decreases. There is vasospasm. As a result, the blood flow to the coronary artery reduces. It increases cortisol and also increases catecholamines, that is acetylcholine. Then adrenaline, noradrenaline, they are more pumped. Then activate platelets. This activation of platelets causes platelet aggregation, that is thrombosis, clotting is caused. Then psychological stress, what it does, it impairs left ventricular function, it increases heart rate, it increases blood pressure, and as a result takes you towards congestive cardiac failure, that is paves path for congestive cardiac failure. Then depressed or psychiatric patients have higher incidence of hypertension than non-depressed patients. Then increased emotions, anxiety and anger, what they lead to? Arrhythmia, irregular heartbeat. Then ventricular tachycardia, ventricular fibrillation. Ultimately the muscle gets destroyed and the muscle fibrillates. Risk of cardiac attack increases. Then myocardial neurosis means worry, tension of heart disease, that is called myocardial neurosis. Every time suffering, I am feeling some heartbeat, so I may be having an attack, I must take ECG. Then it results from acute psychological trauma and extreme stress. So that covers our factor number 2. Then third we see is endocrines. These endocrines is a very big topic, but then we have chosen certain important focusing features here. One is thyroid, and in thyroid, this hypothyroidism brings in depression even when subclinical. That means T4 and T3 levels have not been disturbed, but TSH level gives an indication that there is hypothyroidism. There is very much TSH. So that shows that it is working under a rebuke. If it is working under a rebuke, that means the value of the TSH is very high. Subclinical. Subclinical means not very high, within the range. If it is within the range on the higher side, it is called subclinical. Even when subclinical, then exacerbates existing depression. Already depression is there, thyroid activity diminishes, the depression increases. Then second group is pituitary or ovary in females. Psychological stress induces secondary amenorrhea, that is psychogenic secondary amenorrhea. Then false pregnancy, pseudocyesis, that is there because of this stress, and anorexia nervosa. That is because of the stress, the effect of the stress goes on pituitary and ovary, and as a result the hormones are disturbed and menstruation is affected. Anorexia nervosa is a condition where for no reason the patient loses appetite, and because of loss of appetite there are subsequent conditions. Then gonads, testes or ovaries. Depression is linked with sexual dysfunction, impotence in males, frigidity in females. Then pancreas. In 40% patients with diabetes mellitus for more than 10 years, what happens? Psychiatric disorders occur. Commonest of them is depression. And anxiety, especially stress, causes hypoglycemia as also hyperglycemia. The level disturbs more as well as less. Then anxiety disorder is more common in diabetes mellitus than in non-diabetes. Early treatment of patients with diabetes mellitus aimed at depression that is why very helpful. Then we go to the fourth one, and that is musculoskeletal system. Then musculoskeletal system, we see here not many conditions. One is fibromyalgia and second is rheumatoid arthritis and the pains associated with that. Even though these are two names, this covers a large and a vast population who comes to us for practice. Many of the patients are coming with fibromyalgia and rheumatoid arthritis or rheumatic pains. Fibromyalgia, here there is higher level of psychological stress, strong family history of major depressive disorder, panic disorder, major affective disorder, that is again depression. Common comorbid condition. Nowadays, even in psychiatry, there is a concept of comorbid condition. Like we used to describe earlier, concomitant, which has been misunderstood, and every associated symptom is thought as concomitant, which is not correct. I will not go to that controversy now. But as that concomitant is there in homeopathy, nowadays in psychiatry, comorbid conditions, that is when a number of conditions coexist. So here, homeopathy becomes very much convenient because it is easy to correlate these things. So common comorbid conditions with fibromyalgia are migraine, irritable bowel syndrome, then chronic fatigue, then highest pain scores and psychological distress is noted in patients with fibromyalgia, backache and neck pains. That means the stress level is very high in these conditions. Then rheumatoid arthritis and pains, depression and fatigue are common in patients with rheumatoid arthritis. They have depression as well as they have fatigue. Then many young patients with osteoarthrosis of knee, that is the knee joint disease, have depression. And depression is a common feature in patients with chronic pain. Now this is very interesting. Now which is first, the pain or the depression? There is an interesting equation which we will see subsequently here. But for the present, remember that pain causes depression and depression causes pain. There is a chain. Anxiety is more common in acute pain. When there is an acute pain, then there is more anxiety. Whereas depression is many times hidden. It doesn't come directly. It lies masked in. That is, it is hidden behind. And what is the thing behind which it hides? Insomnia. Patient cannot sleep. Weight loss. Lack of energy or interest. Lack of concentration. Loss of sexual desire. That is loss of libido. Now this is what is shown outside. But behind that, what is masked and what is hidden is depression. In 12% of patients with chronic pain, there is anxiety. 1/8 of the chronic pain patients have anxiety. Now this is an interesting equation which I was telling you. 40% of patients with anxiety disorder have chronic pain. Anxiety causing pain. Now look at this interesting equation. Pain leads to anxiety and anxiety leads to pain. These are two conditions. One condition is pain causing anxiety. Second condition is anxiety causing pain. The ratio is 12 to 40. That is, if 12 times pain causes anxiety, in 40 times Anxiety causes pain. So they are related to each other more in favor of anxiety than in favor of pain. So that is about the musculoskeletal conditions. Then we go to skin. In skin, there are a number of conditions under which we will be studying this. One is general factors in skin diseases. Pruritus is second factor, itching. Inflammatory dermatosis, we'll see what is that. Then chronic urticaria, alopecia areata, psoriasis, and atopic dermatitis. Now these are the cases which commonly flock to homeopath, and homeopath says, हमको डायग्नोसिस से कुछ नहीं करना, हमारे लिए सारी स्किन एक जैसी है, हम अपना स्किन का ट्रीटमेंट देंगे, and ultimately they land nowhere. But then if you try to correlate with this, you will find that you are better equipped to handle those cases. So now let us see general. Skin is the largest organ, well known. Touch, temperature, pain, these are the sensation it carries, general sensations. There is psychological importance because it discharges anxiety. When there is anxiety, there is sweating. And when there is sweating, that anxiety is discharged. Then there is expression of emotion. When a person looks very cheerful, you understand that there is some very good news, and that happiness inside is expressed on the face. If the person is very sad, very depressed, then his face looks gloomy. Then you can understand his face is looking gloomy because of the emotion. So skin is the index of mind, they say in books of dermatology. When emotion precipitates or perpetuates, that is increases, or dermatosis are exacerbated by emotions. That is, dermatosis are the conditions which are skin conditions like vesicular eczema in palms and soles. This is called dermatosis. Then seborrheic dermatitis, that is seborrheic dermatitis on the face at the young age when the girls and boys in adolescent age come to you with acne. That is the manifestation that is associated with seborrheic dermatitis. Then atopic dermatitis, allergy, it is described, skin allergy, that is atopic dermatitis in adult. Then alopecia areata, where there is falling of hair. Then there is psoriasis, chronic urticaria, taking lots of anti-allergic medicines which they take, and from them cetirizine and levocetirizine, and then taking larger and larger doses, and ultimately the medical person says don't take more of cetirizine. But the disease is not controlled because it is chronic urticaria. Pruritus can be local, pruritus can be general. So this is because of dermatosis. And then psychosis or psychomotor disturbances. Remember, psychosis means frank schizophrenia, or psychomotor disturbances. Psychomotor disturbances are where hysteria and fits type of things come. They are represented by formication, numbness, formication. Patient comes and says, the हाथ पैर सुन्न हो गए हैं, झुनझुनी आ रही है. So that is formication, and this formication does not only represent B complex deficiency, it represents the mental features also. Now we see pruritus. Now under pruritus, anxiety with or without associated depression, either both are together or one of them, causes local or general pruritus. Remember that itching represents anxiety as well as depression, and general pruritus in children is very commonly caused by depression, and that you have to diagnose that. Then inflammatory dermatosis is psoriasis and eczema. Psoriasis as well as eczema, they are inflammatory dermatosis. In inflammatory there is weeping eczema where there is secretion, and they reflect there is underlying depression or obsessive compulsive disease, OCD, obsessive compulsive disorder. So that is then we go to the next one, chronic urticaria. Chronic urticaria where a lot of medicine is to be taken, cetirizine, etc. This is because of anxiety and depression. Prescribed remedies which cover the local complaint as well as the anxiety and depression symptoms, and you see the difference. Then alopecia areata. In addition to autoimmune pathology, there is autoimmune disorder. Then other factors are, you can find a history of loss of or separation, history of depression, history of stressful events, and this is responsible, or rather there in the background, which has to be covered by our prescription. Then psoriasis, very common condition where patients come to homeopaths and many of them stay for some time. And one time I was asking a friend of mine earlier that when to stop the treatment. Don't worry, for stopping the treatment, doctor does not decide. It is a patient who decides to stop the treatment. So that is how many intelligent doctors go on. They never say the patient to stop the treatment, and ultimately one day he stops coming to you, so that is the treatment is stopped. That is a very crude method, and that does not show a sign of what we should do. So here in psoriasis is one such condition, because we do not get results. But if we cover these factors, reserved displeasure, developmental difficulties, then in hemorrhagic psoriasis, there is anticipation of rejection. Somebody is going to reject me. Then contrite. Contrite means guilt and remorse. That is the inferiority complex, guilt feeling, whatever wrong has been. We know that this is found in depression. Then shame. Then embarrassment. Suddenly a girl is married to a family which is of millionaires and they don't say anything, but then she finds a great difficulty in adjusting. Girls, ladies have got a very normal tendency to adjust with all these conditions, because every girl has to do that. Even boy, for that matter, he gets a job. After educational qualification, he gets a job, and gets a job in such a company where he is borne by executive class air travel. And then he is told to go to America, he is told to do this, and he is paid all the money. Now this person feels shame, feels embarrassment, feels flawed feeling. So in life situation, or there are people, because this is conceptual. This is psychological analysis which we find in this particular psoriasis. Then atopic dermatitis. Inborn tendencies are correlated with environment. Tendencies are correlated with environmental and psychological factors. Stress of bad relations between child and mother. Then anxiety, tension, frustration, inability to express anger, express emotions, and tendency towards depression. That is found in atopic dermatitis. Now that takes us to the last one, gynecological conditions. In gynecological conditions, we have enlisted women with highly stressful jobs. That is the current scenario. Then female psychosomatic illnesses, then psychological pelvic pain and other features. Now let us see. Women with highly stressful jobs. Early menses occurs, then also spontaneous abortion occurs, premature delivery occurs, with babies low birth weight, babies of low birth weight, then respiratory or digestive disturbances, babies having congenital defects like cleft palate, cleft lip, pyloric stenosis, etc. This, on the background of this, is stress. And that stress has to be covered and treated. Female psychosomatic illness, premenstrual syndrome, then menstrual problems, chronic pelvic pain, then sexual difficulties, infertility, postpartum depression, and menopause, early menopause. These are the things which are related with psychosomatic illnesses, and that is to be analyzed and diagnosed. Finally, psychological pelvic pain. Women 25 to 35 years of age, middle-aged you may say, or pre-middle-aged. Then young, rather you should call 25 to 35 young women, not middle-aged. Then several pelvic surgeries have been performed, history of pelvic inflammatory disease, then complaints of pelvic pain, then dyspareunia, that is painful intercourse, and dysmenorrhea. This is found in psychological pelvic pain. Then other features in gynecological treatment or conditions, history reveals social and relational problems. Patient comes with gynecological disorder, maybe fibroid for that matter, but in analysis you find social or relational problems, recent stress from death or separation, then physical or emotional abuse in childhood and in adulthood. Now you will say what it has got to do? The memory of it remains. And when the memory of it remains at free time or at stressful time, it haunts. It haunts and it disturbs. Then there is self-abuse. Self-abuse is word used in homeopathic language with synonymous with masturbation, sexual self-abuse. But that is not the only self-abuse. Even overwork is a self-abuse. Even eating disorders is self-abuse because you are abusing yourself. Repeated MTPs. Then suicide attempt. These are all listed under self-abuse. Then depression. Waking early, symptoms of depression, poor appetite, poor concentration, lethargy, constipation, negative attitude to life and to self. That is the features important in gynecological conditions. Anxiety, difficulty in falling asleep. The difference between the insomnia of anxiety and depression we have seen. We'll again repeat that in anxiety there is difficulty in getting asleep. Whereas in depression and afterwards when the sleep is there, patient sleeps for long hours. Whereas in depression, the common picture is that the patient is able to sleep in time. But at 3 a.m., he will get up. Or 2 hours before the regular time, he or she will get up. So difficulty in falling asleep in anxiety, palpitation, tension, headache, panic attacks, then peptic ulcer and irritable bowel syndrome. So that covers our talk today. If there are any questions,